And now on the line is Breda Gahan. Breda is a global health and HIV advisor, and she's no stranger to this programme on Near FM. Breda, welcome back to Near FM.
Thanks, Darren, and thanks to all your listeners for tuning in today.
Okay, Breda, today, Monday the 1st of December, is World AIDS Day 2025, although our interview won't be broadcast on Tony's Global Solidarity programme on Near FM on Sunday. As well as today being World AIDS Day, I understand that UNAIDS released an annual report last year. From what I've heard, Breda, after two decades of a mostly big upward trajectory in the struggle to end AIDS, that the situation since Donald Trump has become president of the US has totally changed things, although Donald Trump may not be on his own in that regard. This is a big question, Breda, but how would you summarise the struggle to end AIDS over the years, and indeed decades, up until the present day in 2025?
Wow, there are a lot of big questions, Darren, and I'll get through to them in a sec. But as I texted you and said, for people living with HIV and all those affected, families, colleagues, communities, carers, health staff, HIV scientists and researchers, and I'll come back to that, advocates and activists, it is World AIDS Day every day. I looked at the data, the latest UNAIDS report on data, which obviously covers up until the end of 2024. And in 2024, 40.8 million people globally are still living with HIV and AIDS. There were 1.3 million people who became newly infected with HIV in 2024. That's still hard to believe. Over 3,500 new HIV infections reported globally every day. And 2 of these new HIV diagnoses are in Ireland. I look up the Irish data from the HPSC, Health Protection and Surveillance Centre. 676 new HIV cases diagnosed in Ireland from the 1st of January up until the end of October this year. It's slightly down on the same period in 2024, which I guess is good news. In terms of the global situation, in 2024, there were 630,000 deaths. That's a big war on health in terms of the number of people who have died from AIDS-related illnesses. And I was looking back to see, World AIDS Day was first adopted by many countries at Ministers of Health AIDS meeting in London in 1988. So we're actually marking 37 years of World AIDS Day globally, designated on December 1st since 1988. And you mentioned, Darren, this year's UNAIDS report actually was just released a week ago. And the theme for 2025 for World AIDS Day is the same as the report: overcoming disruption, transforming the AIDS response. And like you alluded to, unfortunately, due to reduced attention to the issue, competing catastrophes, including droughts, floods just in the last 2 weeks, fires, conflict, increased spending on defence, economic and cost of living crises, increasing poverty and homelessness in some locations, leadership has waned, investment in the global HIV and AIDS response has reduced significantly, and progress made in recent years is being reversed. There are significant funding shortfalls in many countries in 2025. And as with everything, reduced investment means reduced responses in awareness raising, HIV education, prevention, treatment, and lifelong support. And without access to effective life-saving antiretroviral ARV medication and quality support service for life, people die. I saw in the latest UNAIDS report that in Western and Central Africa, the number of new HIV infections have not declined at all. 1.3 million of the 5.2 million living with HIV in those locations are not on treatment. And remarkably, sadly, over 9 million people today living with HIV globally are not on treatment, which means they will die. We still have no cure for AIDS. To me, this is a terrible injustice when the medicine to treat, not cure, as I said, HIV exists. Survival or not, it seems, for some people depends on accidental geography of birth. And if I live in Ireland, Darren, I can live positively with HIV and access to treatment, which is free here. If I live in a number of African countries, this is not the case. I'm likely to die prematurely from AIDS-related opportunistic infections. The executive director, UNAIDS, said in the report, Winnie Bayanima, and she's right, behind every data point in this report are people, babies and children, missed for HIV screening or early HIV diagnosis, young women cut off from prevention support, and communities suddenly left without adequate services and care. And prevention services have been the hardest hit. Major reductions in access to prevent HIV, including PrEP, pre-exposure prophylaxis for those most at risk, has been severely hampered in terms of access. Like I mentioned, young girls and women are often, and in concerns work, we see educationally, economically, socially and physically more vulnerable, and those living in conflict areas are especially more exposed to gender-based violence and especially at risk. In 2024, the report stated that every day 570 young women and girls aged between 15 and 24 contracted HIV. Likewise, the services for key populations, including men who have sex with men, sex workers, people who inject drugs, and transgender people, have been severely impacted. People left at the margins. And I checked the latest OECD report, which stated that external health assistance is projected to drop by 30 to 40% in 2025 compared to 2023, again causing more severe disruption to health and HIV services in low and middle income countries. And definitely a failure to reach the global 2030 targets, as the report states, could result in an additional 3.3 million new infections between now and 2030. So it's not looking good, certainly going forward. And you mentioned what's happening in the US, Darren, with the changes there. And yeah, rightly, with changes under the current US administration, there's been reduced funding to the US AID AIDS program, PEPFAR, President's Emergency Plan for AIDS Relief, initiated by a fellow Republican, George W. Bush, in 2003. Also, there's been less funding from the US to the Global Fund for AIDS, TB and malaria, and to UNAIDS, which is the lead coordinating agency globally for the response to HIV and AIDS. There's been disruption due to cuts from other international donors, as higher income countries including Belgium, Finland, France, Germany, Netherlands, New Zealand, Sweden, Switzerland, and the UK have announced reductions in their overall development assistance from this year. Successfully or remarkably, planned increases in ODA include Ireland, Korea and Spain, with Denmark and Norway maintaining existing levels. I read on the Irish Aid web pages that Ireland remains committed to its overseas development assistance programme and working towards the UN target of 0.7% of GNI, gross national income, by 2030. The global investment in the HIV response was almost 20 million in 2023, but has been declining actually since 2020, the beginning of the COVID pandemic outbreak.
20 billion, is it?
Billion, yeah. I'll check that for you, Darren. And there's been a 30% shortfall in funds currently needed. In 2025, the report states that the world has witnessed the greatest systemic shock and disruption of programs globally since UNAIDS started its operations in 1996. And the report ends with a call to action, maintaining funding for the global HIV and AIDS response in terms of international assistance, which must be sustained. Domestic financing in poor countries is not growing fast enough to fill the gap, so external support is needed. And then the whole issue of debt, commitments to restructuring per the G20 leaders' declaration are essential to release resources currently tied up in debt repayments for poorest countries. So a lot going on in terms of the changing dimension of funding really since the outbreak of COVID in 2020. And we're now, half a decade later, going into 2026 next year.
Yeah, I find that terrible. Like a drop of 30-40% in funded to end AIDS since 2023. It's terrible. And to speak about the US, like PEPFAR, I vaguely remember PEPFAR when it was founded back in 2004. I think it was. I was only a college student, but I heard of it back then, and over the years I became more aware of what they were doing, and they had so much success in ending AIDS. I think particularly in developing countries, and for Donald Trump to cut a lot of the funding, most of the funding from PEPFAR and the USAID in general. And I think, I don't know if you have an opinion on this or if you're allowed to state a personal opinion on this, but I think he's kind of inspired some other global leaders to do the same thing. So I do think he is a fault for a lot of the problem. What do you think, Breda?
Well, I mean, the US tends to be a global leader, and, it did galvanize the response and the impetus in 2003 when PEPFAR was formed. Absolutely. Other leaders wanted to follow, the European Union, Ireland, and PEPFAR managed in country with local actors, managed to thwart huge numbers of deaths and allowed so many people living with HIV to live positively. Like, the cuts are causing a reversal, as I said. More people are now getting newly infected, and some people are not receiving their treatment, which means they're more infectious to other people and dying prematurely because the treatments are not available. Most of the services delivered through PEPFAR were by local community groups in rural and urban poor communities who can't always reach formal government health services. They made a big difference. I worked with the US core working group during those early years, and we saw a big change in terms of reduction of fear, breaking the silence, and advocating and supporting people to actually get tested. Before that, people were afraid to get tested because they knew, the result was they would still die. But once testing and treatment came on board, it changed the whole outlook in terms of people living with HIV.
And we do actually have the capacity to end AIDS, HIV/AIDS, because of PEPFAR. It's just a question of funding and allocation of funding. That's the biggest issue, is it? Just that's stopping us from ending AIDS, is it, Breda?
Well, that's a part of it. You asked me there. I remember about the struggle over the years, and I counted up. I was surprised myself, but HIV and AIDS has been with us since 1981, so about 44 years. And from the beginning, the struggle has been led by scientists and researchers, community groups and leaders who've been at the forefront of the response, from ACT UP in New York to TASO in Uganda to the Medical Missionaries of Mary from Ireland, supporting home-based hospice care before HIV treatments were available in countries including Kenya, Malawi and Uganda. And HIV and AIDS was the focus of Concern's work in Uganda. Concern provided financial support to the outreach program of the Medical Missionaries of Mary, who were assisting people in Masaka and Rakai districts between 1987 and 1990. I first visited Uganda in February 2001, and the situation then was tragic. So many people living with HIV dying alone. I visited so many households where they would have had no support without support of the missionaries. And I think it would be great if that work could be documented, recorded, before some of these older people have died and passed on. Mm-hmm. And the struggle has also been led by people living with HIV themselves, who put themselves out there, declaring their status, breaking the silence in the early days, including IMP Plus, the India network of people living with HIV, ICW, International Consortium of Women living with HIV, GMP Plus, the global network of people living with HIV. I spent 3 years in Cambodia. There it was the Khmer, HIV and AIDS NGO Alliance, CANA, NZP Plus, in Zambia, and so on in so many countries. It has been led by activists and singers, healthcare workers and human rights advocates supporting the right of all people living with HIV to treatments and endeavouring to end the ongoing virus of HIV-related stigma and discrimination. I think I told you before, Darren, that I dedicated my HIV-focused thesis, which I conducted in Tanzania in 1994. I can't believe it's 30 years ago, under Liverpool University. And the title was Education and Prevention with Young People. I dedicated to the Ugandan singer then, who sadly died in 1989, Silly Lutaya. Great song, great beat, Alone and Frightened. And it's still true today, you know. Some of the key words were, let's be open, advise the young ones, a new generation to protect and love. Today it's me, tomorrow it's somebody else. It's me and you, we've got to stand up and fight. We'll shed a light in the fight against AIDS. Advocacy and activism is now more necessary than ever in 2025, and we cannot let up, Darren. Mm. As you said there, and I often say, HIV is technically 100% preventable and totally treatable in 2025. Nobody should be dying from AIDS-related illnesses today. And you've heard of the slogan, U equals U, undetectable equals untransmissible, meaning that a person living with HIV who is on daily treatment and maintains an undetectable viral load has effectively zero risk of transmitting the virus to another sexual partner. This is a very important message to communicate. An investment in HIV prevention and treatment is profitable for everyone, lowering new transmission rates and supporting people living with HIV to live and work in their countries.
Okay, Breda, how has World AIDS Day been marked this year in Ireland?
Well, would you believe, Darren, running from just past November 27 to today, December 1st, POSVIBE Tribe and GCN World AIDS Day Festival 2025 is being held, making history as the first of its kind, a 5-day program of remembrance, bold celebration and vital HIV awareness and education. And the festival is built not just on raising awareness, but also on celebrating the resilience and commitment of the HIV and related supportive community. And I will actually join the premiere of a film, a short documentary, Out of the Shadows, by Pradeep Mahadeshwar in Trinity this evening. And this documentary spotlights the experiences of immigrants living with HIV in Ireland, bringing important underrepresented stories to a public audience for the first time. And at lunchtime today, before I started talking to you, Darren, I joined with HIV Ireland and friends at the National HIV and AIDS Monument in the Phoenix Park in celebration and remembrance of all who have been impacted by HIV and AIDS in Ireland and those who have cared for them. We don't know the exact cumulative number of people living with who have died, from HIV in Ireland, because it's not always reported accurately, but it's estimated that over 350 people have died from AIDS in Ireland since the beginning of the epidemic here. And on Wednesday, the Irish Aid World AIDS Day event is being hosted by Minister of State for International Development and Diaspora Neil Richmond, and it will celebrate the legacy of the late educator and HIV activist who lived in Zambia, who I met many times, Darren, Father Michael Kelly. And it will include a conversation with Dr. Mike Ryan, who used to work with the WHO, World Health Organization, to mark 2025 World AIDS Day, again under the theme for this year, Overcoming Disruption, Transforming the AIDS Response. So I'm looking forward to that. And, we can appreciate the Irish government, Irish Aid's ongoing commitment to halt and reverse the HIV and AIDS response globally and in Ireland under the HSE responses.
Okay, Breda, this is another big question, but how would you outline what is needed, including from the Irish public and government, over the next year and short number of years, so that we can still end AIDS by 2030?
Thanks, Darren. What is needed is bold, continued commitment and leadership, resourcing and support to all the frontline organisations and HIV and health-related services being delivered in Ireland currently and globally. As our population here increases, our responses must concurrently expand to meet the need to halt and reverse the spread of HIV and AIDS in Ireland. And like I said, the HSE and service providers are crucial, and upskilling with training as this global pandemic evolves is warranted. I checked the data for Ireland, and the estimated number of people living with HIV in Ireland in 2025 is 9,100 people. And before I end, Darren, regarding another event coming up, is it next week? Yeah, next week. I poignantly want to remember a mother, AIDS activist, and anthropologist, Maarten de Schutter from the Netherlands, who worked with AIDS Action Europe, and who sadly was one of almost 300 people killed when missiles shot down the Malaysia Airlines flight MH17 en route to Melbourne International AIDS Conference in 2014. A community of HIV working colleagues was lost on that day, and I remember it so well because I had wanted to go to Australia. I still haven't been to Australia, as I was on my way to Dhaka during the same week to work with Concerned Bangladesh health colleagues. Now her son, Martin, who was a teenager at the time, has made a documentary film memorizing her life, HIV and related work, and their beautiful relationship. He's only still in his early 20s. It's called My Sweet Child, and it will be screened and hosted by the Dutch Embassy of Ireland in the Lighthouse Cinema on December 10th at 6:30 p.m. with a question and answer with the filmmaker on that Wednesday evening, Darren. I'll send you the link. Maybe we can put it up on the website, and maybe you can even join on December the 10th, Darren, in the Lighthouse Cinema here in Dublin.